Welcome to Monday's edition of COVID-19. I'm Min Sun-hee. Korea's daily tally is hovering well above 1,000 as authorities begin their inoculations of people in their 50s with the Pfizer and Moderna vaccines. Speaking of Moderna, we have more on its rollout here in Korea later on in the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, So-ah, let's start with the numbers for Korea on this Monday.
All right, Sunny, we're starting off the new work week with another record high. 1,318 COVID-19 infections were reported as of 12 a.m. this Monday. And why record high? Because it is the highest figure we're seeing for a Monday, but not the highest caseload we have ever seen here in Korea. And this is how the past week looked like. We have been seeing more than 1,000 cases in the past weeks, and we had even over 1,600 cases reported on Saturday. And Korea's total number of caseload, we will take a look at a bit, but here we have over 1,260 infections that were domestic transmissions. And with that, Korea's total number of cases has surpassed 190,000. Now, with infections not slowing down, President Moon Jae-in himself presided over the government's COVID-19 response meeting on Sunday, that is, and announcing that level 3 social distancing measures will be implemented outside the metropolitan region for all places. And here's his explanation for the move.
최근 가장 우려가 되는 것은 비수도권의 확산세입니다. 수도권 거리두기 강화에 따른 풍선 효과와 함께 휴가지 중심으로 이동량이 많아지며 비수도권 확진자 비중이 35%를 넘어서는 등 전국으로 확산되고 있는 양상이 뚜렷합니다.
So that percentage of cases of domestic transmissions outside the metropolitan region has been on a steady rise recently, over to 37% on Saturday and over 38% on Sunday. And now, as of this Monday, this percentage stands at above 40%. If we take a closer look at the regional caseloads, the capital Seoul and Gyeonggi-do province reported over 300 infections, but the numbers here in the center of the country as well as southeast are looking troubling too. So for these places, if they haven't yet, level 3 will be implemented beginning Tuesday for almost 2 weeks, which means a ban on private gatherings of 5 or more people will automatically be extended for a week, as that rule is currently in effect across the nation until August 1st, regardless of the level each district is placed under. Rallies, weddings, funerals will have an attendance cap of under 50, while most public use facilities must close at 10 p.m. Along with that, drinking at night at parks and beaches is also expected to be restricted.
Right, so meanwhile, on the vaccination front, inoculations for those in their 50s have started on this Monday.
Right, Sunny, and that has begun for those aged 55 to 59, which is roughly 3 million people. So most of those in that age group living in the capital region will receive Pfizer shots, and those living outside the metropolitan region, Moderna, and that is due to adjustments in vaccine supply. Meanwhile, we've got now almost 33% of the nation's population who got at least one shot of vaccination. Now, moving abroad, 10 more COVID-19 cases at the Tokyo Olympics have been confirmed on Sunday, including 2 athletes, bringing the total number of infections linked to the games to 132. Now, daily infections in Japan are on the rise again, with over 5,000 cases reported as of Sunday evening. And taking a quick look at other places around the world, the U.S. with resurgences is now considering booster shots for its vulnerable population, while in Germany there are frightening forecasts that infections could reach 100,000 per day by the end of September due to variant cases. And with that, the country is urging for more vaccination. And the total number of cases around the world now stands at 194.8 million. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, the 2020 Summer Olympics are underway, and while the Games are providing some across the globe with a form of relief from the prolonged pandemic, others, including those in Japan, remain opposed to this global sport event. For more, I have Professor Satoko Itani at Kansai University live on the line. Welcome, Professor Itani.
Thank you, Sunny, for having me here. It's my pleasure.
Right then, Professor, first, I'm sure you'll agree that the opening ceremony of the Tokyo Olympics was a low-key affair in the absence of spectators. What were your thoughts?
Well, I didn't see the opening ceremony itself because I was outside of the stadium when the ceremony was starting with the protesters. And I was really disappointed to see the opening ceremony actually did happen. And this is despite of the growing concerns about the COVID-19 and that the cases are, as you just reported, rising very rapidly. And this opening ceremony really proved and has shown to the world how the organizing committee, the Japanese government, and the IOC really prioritized the profit that comes out of this perfectly optional sporting spectacle over the lives of the people and the opinions of the Japanese public. So I must say, this marked the grave misplacement of the priority.
Right. Professor, so despite efforts to prevent infections, as our Kwon-Soa mentioned earlier, there have been 132 cases of COVID-19 among Olympic-related personnel, and the daily tally there in Japan remains in the thousands. What more can you tell us about your concerns with regard to COVID-19 for the Japanese public?
So the latest news I heard in Japan this morning was that there were another new cases reported, and the total test positive results came out of the Olympic-related population is now 148. And so more than 10 cases are added every day. And this shows what they promised as a safe and secure bubble has been dysfunctional or bursted already. And what's concerning in terms of the Japanese perspective, or the person who is seeing this from the Japanese public perspective, is that the organizing committee have been refusing to disclose the information of who these athletes or who these staffs are, where they are getting the infections. So, and then they say that because they want to protect the privacy of those people who are infected. And yet we are finding out the exact information from other countries whose national committees are disclosing that particular information. Just to be clear about where the infection might be happening. And these informations are crucial to protect the athletes and the public as well, because I'm not an infectious disease expert, so I'm just saying what I've been hearing from the experts. But if you want to know, and if you really want to protect the village and then the athletes and the staff people from this fast spreading the infection, you have to know where exactly where it's happening and how it's happening. And hiding the information prevents the experts to do their job.
Right. Professor Itani, would it be logical to assume then that there has been no shift in overall public response to the Olympics in Japan? Are most people against the games themselves as it enters the first week of a new week, that is?
Well, it's difficult because now most of the mainstream media's attention went into reporting the games and how many medals, and there are less reporting of what is happening in terms of the critical perspective is pushed away. And this is what the sports spectacle does. It has the effect of taking the public attentions, media attentions, even the government attentions from the social issues that we must address immediately. So I'm not surprised to see that many people are now saying, hey, the game already started, might as well enjoy this,
Professor Itani, how do you explain the Suga administration's hosting of the Tokyo Olympics despite widespread public opposition?
Well, I think this has been a pattern even before the pandemic began. The Japanese leading party, LDP, have been criticized for really not listening to public's opinion for a long time and not disclosing the information that the publics are asking. So, but when it comes to the global pandemic, hiding the information, not disclosing the information that's crucial to address the issues are really resulting in this, that they are also notorious for not listening to science. So this is the result of long-term the government's mishandling of the information and public opinion.
I see. All right, Professor Itani, thank you very much for your time and your thoughts.
Thank you.
Right, it's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Monday.
I am Kwon Jun-wook, Deputy Director General from the Central Disaster Control Headquarters. And let us now begin our regular briefing for July 26th, Monday. And as for the COVID-19 vaccination schedule, here are some details. Starting from today, we are providing the vaccines for 55 and 59 years of age. And we are also providing the vaccines to those who have been already booking their vaccination appointments among the age group of 60s, and more in particular, as for about 13,000 hospitals, designated hospitals nationwide, we are rolling out the Pfizer and Moderna vaccines. We are also providing the vaccines for the regional authority vaccines, that is, and we are also providing these vaccines to the age groups between the ages of 55 and 59, and we are also providing those who have not been fully vaccinated as for those under the age of 30 who work at hospitals. And also considering the COVID-19 spread in the metropolitan area, we have been giving out the vaccines, giving the regional authorities here in the capital area the authorities, and this will be now spread to the other regions of the country. And in relation and according to the booking plans, we will be providing the vaccines, and the Pfizer vaccine will be rolled out at about 281 hospitals nationwide. And starting from tomorrow, we will also provide the vaccines at businesses, large-scale businesses. And on Wednesday, 28th, we will also provide the vaccines for caregivers and also the school faculty members. The Pfizer vaccines will be also be rolled out. And also starting from the 10th until the 14th of August, we will be giving out the Pfizer vaccines for those who are eligible, as for the ages, as for those who are getting the college entrance exam, and also they are the people who have been booking their COVID-19 vaccination appointments, and this is about 100,000 of them. And as for these people, they will be able to book their vaccine appointments until the 30th of July, and they could also utilize the websites of the KDCA or also utilize the nearby hospitals in order to book their COVID-19 vaccine appointments. And moreover, as for the age group of 50 and 54, that will begin on the 55 to 59, that is, that will be giving out these vaccines starting from 1st of August. We'll be providing Pfizer primarily. However, at certain places, they will also be given the Moderna vaccines, and we will be utilizing both of these two types of mRNA vaccines for those in the age group of 50. And also we will be giving the individual text messages for those who are eligible to the vaccine. So if you are eligible to get the vaccines this week, we ask you to visit the designated hospitals to get your vaccination. And next, as for the vaccination for these newly enlisted military service members, we were also going to expand the scope. Currently, we are providing the vaccines to newly enlisted military officials, which will be expanded going forward. And this has been giving out and starting from July 12th. And as for the new enlisted military officials, when they also go to their particular military bases, they will also be given the Pfizer vaccines. And as for the members of the policemen and also the Marine Police and also those who are working at the correctional facilities for their military service, they will also be provided with the COVID-19 vaccines starting from the 28th of July. And as for these personnel, we will also give specific detailed schedules because there are specific plans as for each of the departments, including those who are going to serve as military, as the police members, and also they can also utilize the COVID-19 designated hospitals to get their COVID-19 vaccines. And as for those who are not yet inoculated, we will be asking you to get your vaccines at designated COVID-19 vaccination centers going forward. And moreover, as for Pfizer and AstraZeneca vaccines, we are also carrying out the cross injection, and we have done our analysis, and here are some details on the antibody development. And after the cross inoculation, we have seen a 100% development of the neutralizing antibodies, and this also has been higher in those who have been received with the cross inoculation. And there were 0 cases of severe adverse responses, and all of the adverse responses that have been reported were mild and common symptoms. And all of these details will be given to you in the future. And moreover, as for the adverse responses after the inoculation, here are some weekly analyses. And we have had for the past week more than 4,821 cases of these reports. And our total report case now account for about 0.49%, which is lower than the beginning stages of inoculation rollout. And we see that about 59% are mild and common symptoms, and about 5% or more than 5,000 of them are severe symptoms. And Pfizer vaccines, we have about 0.15%, and Janssen 0.66%, and also Moderna 0.7% as for these specific types of COVID-19 vaccines. And as for those who are receiving the cross inoculation of first with the Pfizer and also AstraZeneca followed by for the second shot, we have seen the report rate was higher than those who have received both of the AstraZeneca shots, and also slightly lower than those who have received both shots with Pfizer vaccines. And we are also giving you the COVID-19, as for the COVID-19 recipients, vaccine recipients, we have been giving out the text messages, and about 45% of them have answered that they have experienced such adverse responses. And here are also some details of the case analysis by the COVID-19 Vaccine Damage Investigation Committee, and we have carried out 23 cases of these meetings, and among those all cases, we have seen about 140 cases that have deemed to have the correlation between the vaccine. And also during the latest meeting, we have looked at 106 cases of death and severe cases and 11 suspected cases of anaphylaxis. And we see that 1 case of death and 2 severe cases and a total of 3 cases have been deemed to have a relationship with the COVID-19 vaccine. And on the other hand, the 103 have deemed to have no relationship with the COVID-19 vaccine. And as for this death, we have seen that they have been involving with heart inflammation, and also as for severe responses, one was blood clots and also another was heart inflammation. And as for those cases that have deemed not to have any relationship with the COVID-19 vaccine, we have seen that these were cases with the high age, or also the other underlying medical symptoms like that have induced heart strokes and so forth. And we have seen that about 74.9% was the average age of those who have been experiencing these adverse responses. And we also say that about 80% of those have been reported have also underlying illnesses. And by average, they had about 9 days until they had some adverse responses. And as for these details, we had the 27 were the AstraZeneca and 2 were Janssen, while the 35 were Pfizer vaccines. And as for these anaphylaxis cases, there were no severe cases. And after the mRNA vaccination, we could also have the occurrence of rare heart inflammation. And so we ask you to take particular precautions and monitor your conditions for the next 15 to 30 minutes after inoculation. And also after returning home, please monitor your situation and condition for the next 3 hours. And the same also goes for about 3 days after inoculation. And also about 1 week after inoculation, we ask you to refrain from having and involving in severe workout, physical workout that is. And also after receiving these mRNA vaccines, if you experience heart, chest pain, or also racing heart, or also difficulties in breathing, or also if you faint, and if you see these symptoms newly emerge or become more exacerbated, we ask you to visit a doctor as soon as possible. And as for the Janssen vaccines, about 4 days, after 4 days, or even after this 4 days, if you have severe headache, or if you have a blurred eyesight, or if you also have swollenness of the legs and arms, or if you have a swollenness in the injected area, or if you have any clinical symptoms of possible blood clots, we ask you to visit the doctor as soon as possible. Moreover, if you are doctors who are seeing these patients who have suspected symptoms of blood clots or heart inflammation, please also report to us as quickly as possible. And next, on the quarantine front, on a weekly basis, here are some response measures as well for COVID-19. For the past week, on average, daily domestic infections stand at 1,465, which is about 8.7% on week, and nationwide, we are seeing the spread of the COVID-19 virus. Nevertheless, in the metropolitan area, with the strengthening of the level 4 social distancing, we have seen a downward trend of these new daily average infections from 990 to about 960 this week. However, in the non-metropolitan area, we have seen also, this past week, we have seen a slight increase in the average daily infections to stand at about 492. In particular, in Jeju, Busan, also Daejeon, and so forth, major tourist destinations are witnessing a large sporadic cluster outbreaks as well. And we are also seeing 613 new deaths, and we are seeing a downward trend of our fatality rate. And lately, we have seen most of the cases with a contact with the previous confirmed cases that is currently on the rise, and as well infections from family, friends, and also colleagues. And as for the cluster infections, most of them are coming from nightlife entertainment venues and also workplaces. And moreover, we are spotting cluster infections stemming from public saunas and department stores. And major risk factor is that people visit the multi-use facilities even after having symptoms of COVID-19, and also staying at the 3C conditions for a very long time, and also poor ventilation was also one of the reasons. And aside from the 20s, we have seen an increase in all age group, and out of every 100,000 people, we are seeing about 2.8 cases here in the country. And in short, we are seeing a downward trend in the number of cluster infections and number of new infections in the capital area. However, as a balloon effect, we are seeing the virus spread through other regions, especially in tourist destinations. And also to this end, the quarantine officials are going to have a full management of the strengthening of the social distancing measures, and we have been elevating the social distancing measures to level 4 in the metropolitan area, and starting from tomorrow, all of the other regions will be faced with a level 3. And in order to overturn the current situation, we ask for your continued participation. You need to practice social distancing, wear face masks, and also refrain from having outings, and also going to other provinces or other regions. And also, if you have any clinical symptoms of COVID-19, please get tested as soon as possible. We ask for your participation going forward. Moreover, as for those who have been going to the rallies carried out by Confederation of the Trade Unions, we have some details. And as for the participants who have been going to these rallies, we have 3 confirmed cases, and we have been carrying out epidemiological investigations. And suspected routes of infection, we see that not as the rallies, but we have seen that the virus could have spread through the restaurants restaurant that they have went to on the same day of July 7th. All of the people, the 3 people, they went to this particular restaurant, which was also present by COVID-19 patients. And we see that there could have been some virus infections stemming from that restaurant. And we have also conducted some analysis. We saw that the virus spread could have been very fast within that specific facility. And we see that there has been a high possibility of the virus spreading from that specific restaurant. And we also carried out the epidemiological investigation for about 122 other people who were colleagues and their acquaintances, and we had 0 new cases. And we do not want to stress that this also says that we can guarantee that the latest rallies and demonstrations have been carried out COVID-19 free. However, we would like to once again stress that any large-scale gatherings and rallies are increasing the risks of COVID-19 infections. And please note that under level 4, you can only have 1-person demonstration. And last but not least, here is my final message. As for the COVID-19 vaccine development here in South Korea, centering around our public support team, we have finished our scheme of these incentives and support for these vaccine drug makers. And we will initiate these agreements going forward and very soon. And right now, all of the vaccines that we are rolling out here in Korea are from other global pharmaceutical companies. And going forward, considering and getting ourselves ready for a possible regular shot of the COVID-19, it is very important that we have achievement of the COVID-19 vaccine sovereignty. And this has been once again announced earlier in our government briefings. And once again, the R&D, we have higher possibility of failure than success. However, we want to have high hopes on these success going forward. We will exert our full efforts to this end. And right now, we are also joined by experts. Moreover, we have members of the Korea Association on the Infectious Disease, and we are also having them to roll out more information on those who have been receiving the cross inoculations. Going forward, we will also cooperate with the medical officials and experts in order to provide more scientific evidence of the COVID-19 and the COVID-19 vaccines. Going forward, we would like to also extend our deepest appreciation to all of the scientists and also developers. And once again, we ask you to also acknowledge such efforts going forward. And please take good participation in the COVID-19 clinical trials if they are rolled out here in South Korea. And we understand the challenges, but we ask you once again to take part in the social distancing measures. We are also under scorching heat right now, but please remember the high efforts that are put forth by the members of the medical circles. And we also would like to invite these experts who will be giving us a perspective on the cross inoculation.
네, 그럼 이어서 대한감염학회.
Right, that was Kwon Junuk with Monday's afternoon briefing. So what did he have to say?
There has been an increase by 8.7% in COVID-19 cases in the past week in the country to an average of 1,465. And the rise was especially observed outside the capital region, in particular at major vacation destinations. Also, we're expecting vaccinations to pick up speed with more people subject to inoculation in the coming weeks, not only those aged 55 to 59, and also more positive analysis was announced on cross-inoculation, including prevention against major variants.
All right, so as always, thank you very much for that.
Thank you.
또 50대 접종에 들어가면서 백신 접종이 본격적으로 속도를 내게 될 것입니다.
모더나 백신 예방 효과는 델타 변이에 대해서는 72% 효과가 확인된 바가 있습니다.
고령층에 이어 50대까지 접종이 완료되면 코로나19의 위험도 줄어들 것으로 예상이 됩니다.
COVID-19 inoculations are picking up pace here with the recent arrival of Pfizer and Moderna shipments. Now, for more on these vaccines, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
And joining this session virtually is Ray Jordan, Moderna's Chief Corporate Affairs Officer. Pleasure to have you with us, Mr. Jordan.
Nice to join you. Thank you.
Right. Dr. Kim, will start here then. As of Monday, roughly 33% of the population here has received one dose of the COVID-19 vaccine. Do you believe a boost in inoculations will perhaps stem our fourth wave?
Yeah, I believe so. I mean, according to some government plan, the booster and then another, the first shot for unvaccinated people will just go forward. And there's one issue that we have to keep in mind, that is we always just some supply issues. I mean, the supply, well, if it is just being done in some timely manner, it'll be okay. Yeah, that's what I just expect. So.
Right. And talking about supplies, Mr. Jordan, starting today, that is Monday, Moderna vaccines are being rolled out here for those in their 50s. What are your thoughts, and what can you tell us about the distribution of Moderna vaccines elsewhere around the world?
Well, thank you. We're both honored and humbled to be able to deliver vaccines to Korea. We've committed to 40 million doses, which would vaccinate 20 million people with our two-dose regimen in the country starting mid-year this year, and we're delighted to be able to do this. We've thus far had about over 200 million doses delivered around the world to different nations, and it's been very exciting to be part of helping to relieve the pandemic, especially as a company as we are, having pursued messenger RNA, this new technology, for about 10 years in an effort to bring it into the forefront. And this has been a remarkable, opportunity and privilege for us.
Right. And before I ask you my question, I believe Dr. Kim has a question that he would like to ask you, Mr. Jordan, about Moderna vaccines.
All right. Yeah. Hi, I'm Mr. Jordan. I have one question for you. Well, according to the last phase 3 clinical trials conducted by your company, and then the vaccine shows very excellent the protection efficacy of around just 94%. So can you tell us about just a little bit about such results, and also the recent investigation against the variant of concerns?
Yes, thank you. So the efficacy data that you referenced was from a large phase, what we call phase 3, a clinical trial that was done to look at what actually happened in the real world, right, with the use of the vaccine. We found about a 94% efficacy level. When you look at variants, what we've done is we've looked at the effectiveness of our vaccine against the variants based on what we call neutralizing antibodies. Now, that's not quite as strong an evidence as seeing the cases that occur, but neutralizing antibodies are a biological relevant element. And we have seen that our vaccine seems to be effective with Delta and Beta variants. The level of neutralizing antibodies is diminished from what we saw versus the original strain of COVID, right? Which is not a good thing, but it still seems to be high enough to potentially be protective. So that's a positive signal. But we really have to go do more clinical studies. We have done, within the last month, we also have provided some initial data looking at boosters for our vaccine. In other words, an additional dose of our vaccine. And that has seemed to be also quite effective in moving up the neutralizing antibodies for Delta and related variants of concern. But again, we don't have real world data on these elements yet.
Right. Dr. Kim, meanwhile, what can you tell us about the efficacy of other COVID-19 vaccines against variants like Delta?
Well, there are some sort of just contrasting the data from not all of some several countries like UK and Israel and Canada. But I think the most relevant case that we can actually refer is that study from the UK. And according to their study, the Pfizer and then some AstraZeneca, after the first shot, the efficacy was about just 30s for both vaccines. But after the second shot, the efficacy was about just 80s or the 60s respectively for these the vaccines. So what is important is that we actually have to just complete 2 doses of vaccine to just protect ourselves from the variants of concern.
Right. And Mr. Jordan, as you mentioned earlier, Korea and Moderna have a deal for 40 million doses and a little over 1 million doses have arrived. What can you share with us about the delivery timeline, that is, of the remaining doses?
So we're in regular communication with the KDCA, with the government, to assure that the government understands what the sequencing of doses are going to be so that the appropriate arrangements can be made within the country for the vaccinations. We haven't published, and we would not plan to publish publicly the delivery specifications. That would be up to the government to determine whether to make that public. But we are in regular communication with them and feel comfortable. As you can understand, manufacturing is a continuous process. And in the case of our vaccine, there are several hundred raw materials that go into every individual vial of vaccine. So you can have gaps. You can have both improvements and gaps in the manufacturing process. And we try to stay very regularly in touch with the government so that that's understood. But we expect within a multiple week horizon that the delivery will be fairly consistent. You may have week by week changes in that respect.
I see. Meanwhile, moving on, Dr. Kim, cross-inoculation has been adopted here as one alternative to supply issues. What are your thoughts on the efficacy and safety of cross-inoculations?
Well, there have been a couple of just reports and then some papers published in some several countries. And then according to their the results, the safety and the efficacy is pretty good. Sometimes the efficacy is better than the homologous injection schedule. So I think that's just pretty well proven. And in terms of this heterologous injection schedule, this is not completely new in this COVID-19 vaccine. There was prior examples, for example, some Ebola vaccines. The Ebola vaccine case, there's a heterologous injections was already approved in Europe. And then also there was some experimental HIV vaccine. So this is not completely new. And then theoretically, I think sometimes a heterologous injection may somehow boost the some immune responses after second shot.
I see. Meanwhile, Mr. Jordan, do tell us a bit about Moderna's decision to partner with Samsung Biologics for the fill and finish task of its COVID-19 vaccines.
Certainly. Well, we found Samsung Biologics to be a very promising partner in the region to what we call do the fill and finish process. With our vaccine, you can think of it as 2 big chunks of work. One is to make the vaccine itself, sort of bags of the raw material. And then the second is to turn those bags of raw material into individual vials, which can then be delivered at the physician's office. And we found Samsung in a spectacular place to be able to help us with the second part of that process, what we call fill and finish part. The manufacturing of drug substance, we're continuing to have conversations within the region about whether other Samsung or other manufacturers may be able to help us even with that early part of the process.
Nice. I was just going to ask you about that, Mr. Jordan, because in a June interview with a Korean media outlet, Moderna's chief commercial officer, Corinne Le Goff, claimed your company was considering the production of mRNA vaccine stock solution in Korea. Have there been any advances on that front?
So there's nothing we can there's nothing we can announce in terms of agreements in that regard, but I can assure that we're continuing the discussions about doing that first part of the process in the region. As well, I would mention in other regions of the world, because it's important to be able to allow vaccines to be manufactured in bulk in multiple locations.
And Mr. Jordan, Moderna has also decided to establish a corporation here in Korea. When can we expect this particular entity to perhaps start operations?
I can't give you an exact date on that, but we're still planning to establish our subsidiary in Korea this year. So we're very excited about that, because that would give us both a commercial presence as well as an ability to do research and development work. You may be aware we've come to a memorandum of understanding with the government, both for some research activity in Korea as well as for some potential manufacturing activity. So this subsidiary will give us a place to integrate those activities, and we're looking forward to doing that shortly.
I see. And Dr. Kim, what makes the manufacturing of mRNA vaccines more challenging, perhaps, as compared to that of AstraZeneca, for instance?
Well, for the mRNA, the vaccines, well, in the laboratory scale, it's not really challenging, because we routinely, in the RNA laboratory or RNA virus laboratory, we routinely just produce just mRNAs or other RNAs, such as in laboratory. But that scale is like some dozens of micrograms or hundreds of micrograms. But in this case, this vaccination, it requires just hundreds of kilogram scale. So large scale production is really challenging. And also the stability is the issue. Whenever we actually just handle the RNA in the laboratory, when we do not use the RNA, we always just keep this RNA in the -70 degrees. That's why we always just talking about some cold chain issues, -70 degrees. So the production, large scale production, and the storage is a matter. It's a challenging thing. And also the RNA itself is very unstable. So now just the mRNA vaccines is now delivered as a lipid nanoparticle formulation. So this lipid nanoparticle is some priority, just some patented, already just a patented just a material. So those inventing those things are very just challenging at the moment.
I see.
Yeah.
And Dr. Kim, I understand you have another question that you'd like to extend to Ms. Jordan.
Oh yeah, of course. Well, actually, well, maybe several just a month ago, there was some issue of some waiver of the intellectual property on the vaccine. So I think this is really just a sensitive issues. But what is your thought on this?
This is a very common question and an interesting issue. In fact, last year, when we were in the midst of the pandemic, we considered the issue of the vaccine, the availability, the breadth of it. And we actually published our willingness to forego any intellectual property claims on our vaccine candidate during the course of a pandemic for any company that wished to manufacture the vaccine. So we wanted to kind of remove intellectual property as a limitation for the vaccine. What we've seen as a practical matter is the difficulty is actually, so we removed that, but the difficulty has been finding the talent, the skills, and the raw materials and the manufacturing capabilities to actually put that together. So it's in effect been the technology transfer activity, and that's along the lines of what we've done with Samsung and some of our other partners, Lonza, Rovi, and others in other parts of the world, where that technology transfer has been the critical path, rather than the intellectual property is the critical path, since we've removed that.
I see. And moving on, Mr. Jordan, are there any words of advice, perhaps, that you would care to share with Moderna vaccine recipients?
Well, get your vaccine. But beyond that, what I would say is, look, as you would have any dialogue with your primary care physician in a medical procedure, if there are any existing conditions that you have that may be significant, let's say immunocompromised, position. If you're coming into the vaccine, please, be sure to have that conversation with your physician. Also, after the vaccination, I would expect that the vaccination center would be watching you for a period of 15 to 30 minutes or so for any allergic reactions to the vaccine. That would be sensible. And if there are any subsequent medical reactions that you had following the vaccine, it would be absolutely prudent to connect with your primary care physician about that. We've had, again, hundreds of millions of people receive the vaccine, so there's a wide range of understanding of the kinds of events that might happen following the vaccine. And it'll be important for your physician to assess your own condition in light of those.
All right, Mr. Jordan, thank you very much for making the time to join us live at this very early hour at your end.
Oh, it's my pleasure. Thank you.
Right, and here back in the studio, Dr. Kim, as always, thank you very much for your insights. Right, level 4 restrictions are in place here in the metropolitan region starting on this Monday, and tomorrow, that would be Tuesday, level 3 restrictions will go into effect nationwide for those regions that are currently under level 1 or 2. Thank you for watching.